Right, well, good afternoon all, and welcome to another Parkinson's Academy webinar. And this afternoon what we're going to be talking about is exercise in this time of COVID. Just before that, a couple of the usual announcements. So firstly, as before, very pleased to have the support of BL to help enable these webinars. I'm very grateful to that too. My name, by the way, is Richard Davenport. I'm a neurologist up in Edinburgh. I'm simply your compere. You're going to meet the proper experts very shortly. As I guess I was thinking when I was just thinking what I should say in the announcements. Real pleasure not to have to say things about where the toilets are and fire alarms and switch your phones off and all that sort of stuff, because I guess you're in your front room, so you know all of that kind of stuff. So we can get on with this. So just by way of preamble, as all of us have been talking to our patients with Parkinson's over the last few weeks, whether that's been on the phone, whether it's been through Zoom or Skype or whatever platform you've been using, it's become very clear to us that many, not necessarily all, but many of patients with Parkinson's are suffering through this time. There's lots of different reasons for that, but I think one of the reasons is the sort of enforced inactivity the lockdown in all our various countries has brought with it. And that's why we thought it'd be helpful to sort of talk a little bit about exercise. And we've got two excellent speakers to tell you about those. So Fiona is a physiotherapist, or Parkinson's specialist physiotherapist in Derby, which is just down the road from where I started my medical career in Nottingham all those years ago, lovely part of the world. And Fiona, and as we've sort of trailed a little bit, Fiona's going to sort of talk about what some of the barriers might be to exercise and what you might do to try and overcome them. So Fiona, welcome.
It does flow into some of the stuff that Baz has just talked about. So thank you for inviting me this afternoon. I'm going to just point out a few more of the barriers that we have. Baz has already talked about some of them, and give a few more suggestions for what we can do, particularly with COVID in mind, because COVID has produced a lot of problems around exercising for people with Parkinson's and people without Parkinson's. And I'm going to make a few suggestions, and there will be some links for online exercise and support, which are actually on the website for the Neurology Academy. So before COVID, as Baz has already said, people with Parkinson's have that difficulty with physical exercise because of the motor symptoms and the non-motor symptoms. This paper showed that people, when they were awake with Parkinson's, spent 75% of their time in a sedentary way, and only about 18% of their awake time in low levels of activity, and only 6% being really, really active. So the problem existed before we had COVID to make life even more difficult. And I know that across the world, there are different restrictions on COVID. And here in the UK, we're allowed out for a bit more exercise, but we're still quite restricted in how much we can meet other people, which doesn't help a lot. And Baz has already given us some fantastic evidence for exercise. This paper came out in 2019, just showing some of the things that Baz has already referred to, but also that high levels of exercise can reduce falls risk and fractures and delay your mortality, but also improves that sense of being in control of your own life, your self-image and cognitive function, and enables people to remain independent. And I think that's really important, because those are the kind of things that are particularly impacting people at the moment, where they have been either stuck inside for a long time or are still stuck inside. Whether or not they've got Parkinson's, those can be problems, but it's particularly difficult for those that do have Parkinson's. And we have extra barriers to overcome. And as we get lockdown released a bit, we are faced with a hugely deconditioned population, people with Parkinson's who are deconditioned and people without Parkinson's. And people who had COVID are going to be even more deconditioned. And Baz has already talked a little bit about some of the non-motor symptoms, but I've had some patients who have anxiety as a non-motor symptom anyway, who are now afraid to go out because they might get COVID if they go out, but they're also afraid of what they don't know about the way the world has changed. The anxiety around being in a queue at a garden centre, for instance, because it's all about how would the queue work, and worrying about it for days and days ahead, and just not wanting to go out and be where anybody else might be. So that's another problem that we need to overcome. And there's a paper just coming out that's just been released as an abstract. The content isn't there yet, which is inviting, well, I'm not sure that it's yet inviting us to comment on, but they will be discussing how we can make rehabilitation effective in this post-COVID world, because the need for rehabilitation in older people with or without Parkinson's is greater than it was before, and yet we can't deliver rehabilitation in the same way that we did 10, 12 weeks ago. So the paper is going to be looking at different ways that we can design and implement this new rehabilitation, which has kind of pushed us into things the NHS was thinking about doing in, I don't know, maybe 2 years' time, 3 years' time. I think my trust was thinking about doing NHS Attend Anywhere in 18 months' time, but we've suddenly got it done in 10 weeks' time. And those kind of things, they've been huge challenges, but we've had to think outside the box. And I think we're going to need to keep thinking outside the box to keep people active and exercising. And we've heard about some of those barriers already this afternoon in the motor symptoms, and those low expectations of what people think they can do. They might well be lying on the sofa with the remote control on their belly while they're imagining the six-pack, but they might also be thinking, it's too late for me, I'm too old to exercise, or it won't make any difference. They might be frightened of hurting themselves. That could be about falling, but it might also be about, I might pull a muscle, or what if I hurt myself and I need to go and see a doctor? I don't want to go and see a doctor at the moment because I might be exposed to COVID by being outside the house. So we've got all those extra fears. Apathy is an absolutely massive one. And I think that's going to be an increased problem for the people who've been indoors, because the stimulation hasn't been there from other people and perhaps from other family members. And Zoom has been great, but you can probably get away with putting your feet up while you're chatting to people, not exercising at all. And family might not spot what's going on in terms of less activity. Talked a bit about fatigue and low mood and depression. And it may be that people say they haven't got room to exercise, or that they haven't got, maybe they will exercise at the gym, but the gym is not open at the moment. Maybe there isn't anybody at home to motivate them, or maybe there is, but they won't motivate them, or maybe they don't want to listen to their wife saying, come on, you've got to exercise. Or maybe they just don't know what to do, or they don't have dumbbells and they haven't thought of picking up a baked bean can or something. So there are a huge number of barriers, and I think it's really important, particularly for therapists, to be able to identify what is the barrier here, what's stopping this person from wanting to exercise, or maybe they want to, but then they can't follow it through. So I think one of the first ways on breaking a barrier, particularly for those who haven't been very fit before, is to use the word activity rather than exercise, because that word exercise can sometimes be off-putting in the first instance. So just saying, just do something more than you're already doing, but emphasizing how important it is to get out of breath. I think that education of sharing the evidence with people, why it's important, what changes it will make to their lives, is the best motivation there can be. And as Baz said, I think probably this afternoon after this, we're probably all going to go out for a run and make sure we get out of breath. But I think helping people just to take that next step without imagining they're going to need to run a marathon tomorrow, but just to walk more briskly, or whatever it is from their starting point. There are there've been quite a lot of papers on, and there's a number of suggestions from the evidence and other things here And I think that reward idea from the app is a great idea, that where the person's going to get a reward from the activity they do from Baz's study. But sometimes you can also give yourself a reward. So rather than saying, oh, I should have gone for a run today, well, I didn't because I just couldn't get my act together, to actually prepare in advance and say, when I've gone for a run or a bit of exercise, then I will allow myself to do whatever the reward is going to be, and just changing the mindset. Managing expectations, helping patients to be realistic in what they're going to be able to do next. There is some evidence for phoning patients up, and I think Baz's paper on being able to ring the patient up and say, we can see you haven't been exercising today, or here's some more exercise, that can be really helpful. Sometimes online support from a group, at the moment quite a lot of exercise groups are meeting by Zoom. Even Parkinson's local support groups are meeting just to chat and encourage each other to exercise more. In the past, they would have been meeting in person as well, and I think that's a great way for exercise, but it looks like that's not going to be happening for at least the next few months here. Our trust isn't going to allow us to bring anybody in for a group, so we perhaps need to find a way of doing a group on Zoom or some other format. There are different apps that you can get to exercise, apart from Baz's custom-made one for the study. But one of the studies showed that they made an app that they could use to track patients in a different study. But I think also just giving people pointers to apps that will monitor in terms of giving them a score for the game they played or the thing that they did that had them active. I've got a couple of, well, I've got one suggestion at the end of this slide set. I think it's important to point people to all the online exercise options that are available, particularly at the moment, and they're emerging all the time. But it's also good if we can to follow up and say, did you join in that exercise group, or have you been exercising this week? That's very difficult at the moment because we're struggling with staff redeployed and huge time constraints in terms of managing all our patients in a different way, which seems to take longer than it did before. But I think it is really important to try and help people to peer support, and for us to then be encouraging those who are struggling the most. The Borg, the Borg, that should say Borg, not Berg. The Borg scale of perceived exertion can be a really good way for people to see what level of exercise and exertion they're doing and see if they can push themselves a bit more. But for those who tend to sit in their chair all day, maybe just encouraging them to get up and move every hour and go and make a cup of tea as a starter, and then to encourage them a bit more. Maybe they could be more vigorous in the housework or the gardening. And as Baz's app has shown, it really does need to be fun. I think none of us are going to exercise very much unless we either think it's fun or it's going to benefit us enormously. I think it's also important to say that for those who have apathy, as therapists, it's important for us not to throw our hands up in the air and go, well, you've not bothered doing the exercises I gave you, therefore I'm not going to engage with you anymore, and I can't do any more for you. I think we've got to find the motivational tools to encourage that person, to support the spouse, to encourage the person as well, so that they will engage with some level of exercise. And maybe we have to make it in small increments to enable them to take it on. So these are just my last couple of slides, are some pointers to places where there are online classes. Some of them are, you can do them live at the time, or you can catch up on YouTube. Some of them are personalized. Reach Your Peak will do 2 weeks of personalized free. There are all sorts of different types there. The Parkinson's Foundation does different Fitness Friday. And there's the EPDA website actually has 5 different types of classes and there on, and suggestions. One's boxing, another one is dance. Parkinson's UK have just brought out this booklet on advice for people managing COVID, and just switching my plug on, my battery is about to run low, sorry. And they've also done on their website advice for patients who are going to have telephone or video appointments, because that's quite a challenge for people who have not been very internet savvy. And if we can actually get them doing these online video appointments, then we've got a greater scope for doing exercise online, one-to-one. There are also resources for professionals in terms of COVID on their website. And PD Warrior do a free app, which is a great way of encouraging people to do aerobic exercise. But there's also lots of other apps around. The Clock Yourself app's a good one for dual tasking and cognitive challenges, where you imagine a clock face on the floor and you have to respond when the app shouts out the numbers to move your feet to the right spot. So I think exercise is so important, but COVID has made it harder. And now we need to find the ways to break those barriers down for ourselves as much as anybody else, but particularly for our patients. Thank you.
Fiona, thanks very much. That was a lovely complimentary talk to Baz's talk. And you just in that final slide, you started to address this issue, but we've got a couple of questions, two questions, but very similar kind of issues. And that is the problem of the old, the sort of very elderly, the 85 plus, who are often a bit frail, and it's a slight generalisation, but many aren't that au fait with IT and so forth, and how we engage them, particularly in the current climate. I mean, I know you just addressed some of that, but any other thoughts?
It is difficult. I think telephone support for them and sending out exercise sheets and then following up, have you managed to do the exercises, seems to have worked for some of mine. It's not ideal, but it's definitely better than nothing. And giving those, trying to imagine that person's world and finding a way that you can just ask them to do 10% more than they did the last time. Just again, those incremental things. But it is difficult. But I think that generation are going to struggle if they haven't developed those skills at the moment. Some have learned how to use Zoom to just be in touch with family, but a lot haven't.
Yeah, I guess that's the point, isn't it? Harnessing family and friends to sort of help support that kind of thing as well. I mean, there is a certain group that you're never going to quite reach. One appreciates, but there are some other thoughts there. Yeah. So a question perhaps for both or either of you. What about dancing in Parkinson's disease?
Fiona, want to go first?
Yeah, okay. There's quite a lot of evidence for different types of dance, and it's fun and it's a social activity. So yes, it's a good thing to do. I think there's an organisation called Dance with Parkinson's that uses quite a lot of self-expression, which is really good as well. But yes, dance is absolutely fantastic for Parkinson's.
Yeah, and again, I guess, as you were saying, the self-expression idea, I guess it's more than just the physical activity. It's back to Baz and the 3D immersive apps, and that there's more going on and doing more to plasticity in your brain. So a slightly a similar question, what about yoga?
Yeah, I'll take that one. Yoga is also interesting. The relatively poorly studied, although there has been a recent study in JAMA Neurology where it has been taken to the test, somewhat of a complex design where they combined yoga with a mindfulness intervention. I have to say my disclosure is that I'm a believer in both. I think particularly in this time of the corona crisis and stress alleviating interventions such as mindfulness are really good. So they tested yoga combined with mindfulness. So which one of the two did the job, I don't know, but it was better than nothing. So that is the first scientific evidence. It is good to emphasize that I think yoga is good, but I don't think it will always give you the aerobic component, the heart rate increase or the panting that you need to drive the plasticity in the brain. So I see that as complementary to aerobic exercise. But Fiona, please correct me because I'm not a yoga buff myself.
Neither am I. I think the flexibility side of things is really good. But again, I would agree, you need the aerobics. And it's that combination of exercises. One type is not enough. You need the aerobic, but you also need to be flexible. You need to challenge balance as well.
Yeah, and I must admit, when I mean, lots of my patients are like yours as well. Do yoga or Tai Chi or Pilates or whatever it might be, and whenever they ask me, I generally encourage it because it just seems to push you down that particular line. I have to say, I used to say to some that I thought a lot of what they gained was the sort of just the interaction with other human beings, because usually you're doing these things in groups. Of course, that's not the case with COVID, and I think it's the black box effect of these things. There's lots of things going on that we don't quite recognize, and one suspects that maybe Pilates in your front room via Zoom is not quite the same as Pilates down the church hall with the group. I've got no evidence to support that, but it's just a theory. All right, now here's an important practical question. I'll read it out. Is there a specific exercise leaflet we can give out for Parkinson's patients to be used safely for people who live alone? And the questioner is acknowledging that they've been through the ones with Parkinson's UK and was not entirely convinced that they were safe to use. So again, is there any what did Fiona and Buzz? What do you tend to sort of recommend? Any particular written material?
Fiona, please go first.
Well, I tend to make my own. So I think it is important if the person with Parkinson's is a patient and we know them, then we know what their particular problems are. So I try to adapt my exercises so that they will be appropriate for that individual and safe for them. So if it's also got to be challenging at the same time. So I think my advice would be you need to take the aspects of the ones that you can find on other websites and use the ones that you think will be safe, and then add your own.
Yeah, I completely agree, Fiona. The two things I'd like to add is, so one, I think Parkinson's UK is doing a wonderful job in providing you with useful information. So use that as a resource. The other thing is, can Liverpool Football Club do without a coach? And the answer is no. Can Chelsea do without a coach? No. Can a Parkinson patient exercise without a coach? And the answer is, of course, no. So even if you live in remote areas, I think you as a patient deserve, and that is in capital D, deserve a coach who sits down with you, looks at your abilities, preferences, barriers, and facilitators, and designs a custom-made exercise program. And there's no ifs, ands, or buts. And if the corona crisis has taught us one thing, if you can't go to the therapist, and even if the therapist can't physically come to you, there is still such a thing as telemedicine. And I think, and Fiona, please help me out, but I think even remotely, you would be able to coach people, at least to a decent extent. Yep. But I think you folks deserve a coach and a tailor-made program.
Agree.
And this next question is helpful because it reminds me, and it's a question about Nordic walking and as a form of exercise. Just before I give you a chance to answer that question, there is on the Parkinson's Academy website, there is a PDF leaflet about Nordic walking, and there's also a YouTube video, a 15-minute video about Nordic walking, which is actually a bit more complicated than I originally thought. But there's a video to sort of watch there. So again, any particular comments on Nordic walking?
Yeah, we published a paper actually on it. Happy to send it to Sarah so she can share it with the delegates today. We published a paper which showed that it is one of the many efficacious exercise interventions. It's not the only one. What I like about Nordic walking myself is two things. One is it creates stability because the poles provide stability. The other thing is it stimulates you to make the arm movements. So it's probably a better way of producing a decent workout. And it taps into what we call the so-called spinal pattern generator. So if you look at a normal people walking, you don't realize, but as soon as your left foot swings forward, your right arm swings backward and vice versa. This is an automated mechanism generated by the spinal cord that is defective in people with Parkinson's, and you stimulate that system by this forced arm and hand movement done with Nordic walking. So I'm a great fan, I have to say.
At the moment, it's going to be an outdoor activity, which is going to be the safe place to be.
Yeah.
Yes, exactly. Very good addition.
Good point. And we've got another query, and again, Fiona, you might want to take this one first in terms of barriers. So the question about postural hypotension as a problem with, particularly with running or walking. Any comments on that?
I think if somebody has a problem with postural hypertension and it's worse if they're running, they might have exercise-induced postural hypertension. Then there are some practical things you can do, like making sure you're hydrated properly before you go, making sure your carb levels are up before you go. Time of day is a big thing about when it's better to exercise later in the morning rather than first thing in the morning. I think it's something that that's a good time to make sure you've got a coach working with you on when to exercise, how much to exercise, getting that postural hypertension under control as well as possible. And perhaps you have to also manage the distance that you're going to go for a run. There will be a distance where the postural hypertension might kick in. So having the means to solve that problem when you're out on the run if necessary. Yeah.
I'd like to add two things quickly, if I may, Richard. The one thing is, so the threat of postural hypotension is, as Fiona mentioned in passing, is that people faint after exercise. And one particularly notorious moment is people climb the stairs. They cannot bring up their heart rate, but the blood pressure does drop after the exercise. And then you faint at the top of the staircase, stumble down with all its negative consequences. So treating postural hypertension is treatable. I wouldn't say it's completely treatable, but it's definitely treatable. Maybe too much detail for here now. The other thing that I just wanted to mention quickly is, if I go to exercise, my brain squeezes out a bit more dopamine in order to allow me to exercise. Now you've got Parkinson's. If you have off periods, or if you find exercise is difficult, just take an extra pill of medication, ask your nurse, ask your Parkinson neurologist, but it's perfectly fine to adjust your schedule of medication in accordance to your exercise regime. Take some extra medication prior to exercise. It will allow you to enjoy a better workout, which is good for your brain. Would you agree, Richard?
Yeah, no, I absolutely. That's an excellent point to make. Well, in fact, and I think we are just on the hour, so I think we shall bring this to close. It's been a huge. I've massively enjoyed the last hour. It's been hugely enjoyable. Thank you very much both to ParC and Fiona. Thanks very much to BL and the Parkinson's Academy, and thanks to all of you for listening. And have a good and active weekend. Thank you.